Here we're gonna go over scar massage directly on the scar itself. So this is something that you would not wanna start until 6 weeks at least. Just making sure that there is absolutely no scabbing or openings on your incision. It's fully closed. So if at 6 weeks you still have some scabbing, then I would continue to wait until all of that is gone. You want it to be a nice pink line before you begin directly putting pressure onto the scar. It's important to note that some people are totally fine just diving right into massaging their scar, and it's also very common that people feel like they need to ease into them. It might give them the heebie-jeebies a little bit to touch it. They might feel a little bit emotionally unready to touch it, and that is all very common, but something that honestly, as we ease into this, can be very helpful. So I just try to recommend going at your own pace, starting really slow. This is something that you can do for many, many months postpartum, and so just ease in at your own pace, knowing that it's okay to go a little bit slower. So some of the benefits of scar massage that we're looking for are to improve the appearance. So doing this will help reduce that inward pulling that you might be experiencing. It'll help decrease some of the numbness and hypersensitivity around the scar. It will help decrease some of the potential symptoms that scar tissue can contribute to, like pelvic pain, low back pain, hip pain, and even things like bladder dysfunction. So starting this scar massage is gonna yield a lot of benefits. For this section, I'm gonna show you guys the scar massage with a little bit of lotion. There will also be an instructional video on doing scar massage without the lotion, and we'll talk about that in the next video. But you'll have a little bit of lotion just to start to ease into this and make those tissues glide a little bit easier. And we wanna put it directly on the scar. So we're gonna put that lotion there, we're gonna start to touch that area, and we're gonna start by doing some different movements with the goal of allowing the tissues with each layer to start moving as independently from the other one as possible. So we'll start with doing just some horizontal movements going side to side, and I'm just taking my fingertips and moving along the scar itself. So we'll go vertical and horizontal movements back and forth, and you can vary the amount of pressure that you put into it, just kind of meeting yourself where you're at. You okay? All right. If there's an area that feels like it's more tender or more stuck, you can definitely stay on that area a little bit longer. You're gonna start to do some clockwise and counterclockwise movements, so just some circles. And then we're gonna do a cross friction. Cross friction basically looks like a little S shape. And so we're gonna be with two of the fingers moving the scar in one way, and then with the other two moving in another one. So again, just trying to make almost like a little S shape as we move down and back. And on a lot of scars, you'll notice that there will be an area that maybe feels more tender or just like doesn't move as much as the other one. And again, that can be an area that you stay on a little bit more. Next one is gonna be, I'll call a pin and pull, where I'll just pin the tissues below the scar down and then really get a good grip on the scar itself and pull away. So you're almost like creating this space in the scar itself and gently stretching it. I reassure my patients that like this is not gonna be something that just pulls the area open. The scar has nicely healed, and 6 weeks is enough time for all of that to be very secure. And again, you're just meeting yourself where you're at, but sometimes I have to reassure people that it's not gonna just bust open. So again, anchoring down, gently stretching and pulling that area. And then lastly, we're gonna do some sweeping. So I have people just kind of have their fingertips start below the scar and just gently sink them in and sweep, very similar to what we did with the abdominal massage, but you're just starting right below the scar. Your tension is really right in here. Does that feel tender?
Yeah.
Yeah. And just sweeping over the scar. So starting right below it, sweeping, and you can kind of just go a couple inches above. So again, intensity is something that's really below a 3 out of 10. Nothing that you're just grinning and bearing through. You're trying to just ease into it. Should not be something that leaves you later that day and the next day feeling like you're very sore and it's intolerable. It should be something that feels therapeutic, and it's okay to feel like you're reaching a state of a little bit of tenderness, but not pushing aggressively through that.